Hi everyone, Dr. Washeke here. Today I want to get into some serious stuff. Headaches, to be just something benign. Boyfriend caused a headache, husband caused a headache, and you get over it. But sometimes a headache is not just a headache. And that's what I want to talk about today. So according to the NIH, National Institute of Health Statistics in 2019, about 39 million people in America suffered headaches. That's a huge fraction. According to the World Health Organization, a half to three-quarters of adults suffer headaches. But also, guys, I want you to remember what type of headaches are there and when are you going to the doctor's office. So, there are three types of headaches. There is a primary headache, secondary headache, and what we call neuralgias. And the primary headache is usually your tension headache, your cluster headache, and your migraines. There are quite a few migraine sufferers in this world. But I want to specifically look at when is a headache becoming like something that you don't want to deal with, something that you don't want to take lightly. So, cluster headaches. Usually young men between the age of 25 and 45, they'll tend to have cluster headaches. And basically it's just tension in the muscles around the head. Sometimes it may be the forehead or the occipital cavity. Sometimes it could be temporal, meaning the sides of your heads. And usually when you take an over-the-counter medication, that should solve that. So primary headaches can be solved. Over-the-counter medication will do the trick. Some migraine headaches, especially women in their midlife between like 25 and 55, a lot of women will tend to suffer from migraine headaches. And there are specific medications that are prescribed for migraine headaches. The only thing to watch out for with migraine headaches is what we call a rebound headache, meaning that you had a headache, you took your medication, sometimes you are on a prescribed medication, but then it comes back with a vengeance. Now, you need to be concerned, especially if it is relentless, it is recurrent, and it is severe. When a headache is getting worse, meaning that it is not resolving with over-the-counter medications, and you have a history of migraines, you are a female, you are in your 40s, you're looking at menopause or you're premenopausal, you should be concerned. One of the things that I would look out for is blood pressure. So you want to make sure that you are not hypertensive, because some of the causes of headaches include hypertension, dehydration. You know, sometimes you're not hydrating enough, and when you're not hydrating enough, there's a good chance that you will have a headache. Alcohol, believe it or not, that lovely glass of rosé, that lovely glass of Cabernet Sauvignon will give you a headache, especially if you're not, it's not customary for you to enjoy a glass of wine. It will not be surprising to me that you will show up with a headache. Sometimes it's hormonal changes. So women, we are going through premenopause or we're going through menopause. So guess what? Your estrogen and progesterone are no longer the same. It will not be shocking for me to see you coming into the clinic with a headache. Another thing is foods. For me, my trigger, MSG, monosodium glutamate. Well, the MSG tends to have a whole lot of sodium in it. And with sodium, you know you're going to be using the bathroom quite a bit to pee. And for that reason, you're going to get dehydrated. And once you're dehydrated, then we go back to the same thing. You're going to have some issues with headaches because you're dehydrated. So, when should you worry? If your headache is accompanied by nausea, vomiting, dizziness, a change in your speech, like you're speaking garbled or you're slurred, you have weakness on one side, like say for example you try to smile and the people in your life, or your husband, your wife, your family members are like, this looks weird. The face looks tilted. When she smiles or she sticks out her tongue, it looks tilted. It looks like one side is not quite moving. You try to lift up your arm and sometimes maybe one arm is not moving up. You should be very concerned because those are clear signs and symptoms of a stroke. Sometimes it could be accompanied by a fever, especially now with COVID-19. I mean, guys, I just want us to be very careful, listen to our bodies, and just think about, some of the things. I do not want us to become hypochondriacs. That's not the point. I'm just thinking about you being more sensitive and more cautious. So if it is accompanied by a fever, like I said, nausea, vomiting, if you have one-sided weakness, that's a 911 call, guys. You're going to the ER because it's possibly a stroke. If a headache is severe, gets worse, it does not resolve with over-the-counter medications, go see your physician. There are very simple tests that can be done. Sometimes they're a bit costly, a CT scan, an MRI. But I'm not saying that you walk into your physician's office and demand for this. Usually, most healthcare practitioners do have an algorithm that they walk through. If the headache is this, then that. If it's not resolving with this medication, then that. So your physician might not be like jumping the gun, trying to get you into a CT scan or an MRI just because you complain of a headache. However, if it keeps recurring, do not ignore it. Go see your physician. One thing I want to ask and encourage you guys to do is listen to your body. Pain is not a normal thing. A headache is not a normal thing. However, sometimes you could have a headache because you're stressed out, but that doesn't necessarily mean that it should not dissolve. So I'll reiterate in saying that if your headache is ongoing, it is persistent, it is not resolving with over-the-counter medications, it's time to probably see your primary physician. In the situation that I had with my friend's friend, it turns out she was having persistent headaches, some nausea, some vomiting, some dizziness, and it wound up being a very serious condition that required surgery. Is that the best situation? Absolutely not. But we have her in our prayers, and we're lifting her up to God for healing. And I just want to remind you guys, life is so good, love is even better, and happiness is you. So take care of your body and listen to your body. With that, goodbye.